Hi guys, welcome back to the channel. Today we have another genetic counselor interview. This interview is with Jacquelynn Berton. She is a mainly prenatal genetic counselor, but also has some very interesting specialties in a pharmacogenetic counseling and psychiatric genetic counseling that you'll learn about. So those are really interesting and unique. We're going to delve into that a little bit, and as well as some other great advice and general insights about the career. So I hope you enjoy this one.
Right. So just to start things off, would you mind giving a little bit of an introduction about yourself and maybe your educational background and how you got to where you are right now?
Yeah, sure. So my name is Jacquelynn Berton, and I'm a mostly prenatal genetic counselor. I work at St. Elizabeth Healthcare, which is in northern Kentucky, right over the river from Cincinnati. Um, I went into grad school 4 years after I graduated from undergrad. So, um, there's people all over the spectrum who come in either straight out of undergrad or even, as second or third careers later in life. So I'm kind of in the middle. But my undergrad was in psychology and also creative writing, actually. So nothing super related to genetics. And in fact, I never even took a genetics class while I was in college. So I kind of had to catch up a little bit on prerequisites after I graduated. But um, that was my educational background. And then kind of just spent a few years after college trying to, figure out what I wanted to do because I wasn't quite sure about all that. And somewhere along the way found out about genetic counseling, and the rest is history, as a lot of people say. So
That's really interesting because it's nice that you can always find a way to get into this, even if it's been a couple of years since you were
mhm.
in undergrad. What did you do specifically in that interim in terms of, I guess, like maybe just the job you had or what you were exploring, as well as catching yourself up to meet the prerequisites of a genetic
Mhm.
counseling program?
Yeah, those are great questions. So I didn't find out what genetic counseling was or that it existed until the year I applied, actually. So I wasn't really gearing myself towards this necessarily, but I did know that I kind of wanted to do something that involved healthcare, possibly research, maybe those two things together. Um, I knew from my psychology background that I didn't want to, be stuck in a lab somewhere. So I wanted to kind of interact more directly with people. But um, because I didn't really have any of that background that would enable me to get into any type of program or job, I started by kind of shadowing, just different specialties. So I looked into like nutrition, I looked into occupational therapy, I looked into all kinds of stuff. And honestly, most of the time that I was out of school before I entered the grad program, I wasn't working in a healthcare field. I was working like in a law firm um, or at a coffee shop or, just kind of random places. But I really tried to, in my free time, look into these different types of fields that I was interested in. And I think that was really valuable because it kind of led me to understand what I did and didn't want in a career. Um, I started working at a local behavioral health institution. And that was the year before I applied to school. So that enabled me to actually put my undergraduate psychology degree to use, which is really rare because you don't really find a lot of jobs that let you do that. So I was a case manager for individuals with severe mental health disorders. Um, and that was extremely challenging and interesting and informative. And it really led me to kind of understand obviously more about mental health and the challenges that people within that, the system of the mental health care um, system, experience things and what kind of barriers they face. But also just, case management, like keeping track of things, really having to be on top of following up with people and advocating for clients and working with, different segments of healthcare and mental health care. So um, that was really interesting. And I also, like a lot of people did, I spent 2 years working on a suicide and crisis hotline and as a volunteer. So um, I think those two things together were really valuable for understanding, first of all, that I wanted to do this. And then also, I think, actually interviewing for programs, they liked that I had that kind of experience. So um, I think just, yeah, I mean, it's a long answer, but the short of it is that, try to get into things that you're interested in. even on a volunteer basis, because unfortunately, I know that's a privilege. A lot of people can't, afford to, just take time out of their day and out of their lives to volunteer in these ways. But if you can do it, it's really helpful. And I also had volunteered in an emergency room for a little bit, and that was as a they called it like a family liaison, so someone who kind of helped the families who walked in, like looking for their loved ones, and providing them the information I could provide, and then also kind of helping to calm tensions and things which can happen. So that's kind of the long story of what I was doing in between. And all of that, once I found out about genetic counseling, I kind of realized, like, oh, that actually all is good experience. And it happens to fit, even though I didn't know I was going for that. And then when it came time to actually doing the prerequisites, honestly, I just found an online program that offered genetics, and did it that way. And I reached out to the different schools I was interested in to say, hey, this is going to be my only solid genetics class. Is this going to be acceptable? And I think I applied to 9 schools, and all of them said it would be fine. I don't know if that's still the case now, but I think they are pretty good about understanding that not everybody can, like, quit their job and like go to take a genetics class in the middle of the day. So if it's from an accredited online school, then, or a school that has an online class, then I think most programs are fine with that. So I did that, and I did the same thing with biochemistry, because a couple of programs required biochem. But overall, my psych degree actually did overlap quite well with a lot of the requirements.
That's really, really great. It seems like a lot of those experiences you had, particularly with like the volunteering and the working, definitely, it's just funny that you didn't really know you wanted to do genetic counseling at first, because if you had gone in wanting to do that, those all would have been perfect things to set yourself up with. But I did notice, you just reminded me with the psychiatric position you said you were involved with.
Mm-hmm.
On the NSGC site, when I found your contact, it mentioned psychiatric disorders. Is that something you've ever worked with specifically in genetic counseling?
Yeah, so in genetic counseling, there's very few centers. In fact, there's only one that I'm aware of. I think there's probably a couple, but I know the University of British Columbia is where they actually have a psychiatric genetics clinic, and the people who work there are absolutely amazing. So when it comes to me being able to do psychiatric genetics in my practice, it's not that I have a specific time slot set up that says, if you're experiencing a psychiatric disorder in yourself or in your family, you can come in, like, set up an appointment just to talk about that. But it usually ends up coming in other ways. And I think that, that's definitely an interest of mine that I try to work into other types of appointments, because I think it is important. And it can be really helpful for people. So for example, my main type of counseling that I do, that I spend most of my time on during the week, is in prenatal. And a lot of the time, some healthcare providers spend time talking about, mental disorders that can be experienced by one or both parents during the perinatal period. Or, we hear a lot about, like, postpartum depression, for example. But one thing I try to talk with my patients about, especially if they're struggling or if they have a family history, is that it's not just postpartum. It can be during pregnancy, around the time of birth, and after. And it's not just depression. It can be depression, anxiety, OCD, even psychosis in some cases. So I'm not at all an expert on these things, but I think, when you're working with people who are more likely to experience issues like that, I think it's important to kind of normalize it and just say, like, look, this is not your fault if this happens. It's okay to seek help. There is help out there. It's, a pretty much a normal biological thing that's occurring, except that it's not normal in the sense that you need to, just sit there and struggle with it. Like, doctors are getting a lot better about understanding why people experience those kinds of thoughts around pregnancy. So for example, I'll do that. I will also do pharmacogenetic counseling. So a lot of times people who have been through a lot of different psychiatric medications, so anti-anxiety, antidepressants. If they're cycling through a lot of these medications and not finding one that is really working for them, or is giving them a lot of side effects, there is pharmacogenetic testing out there, which can kind of analyze a person's genomic markers and try to figure out, which of these is going to interact in the most manageable way for that person. So that's something I kind of talk with them about. And again, from my standpoint, it's not about interpreting, the lab report. It's not about prescribing medications or making recommendations. All I really do is the pre-test counseling, where I will talk with them about, this is what the test can do, this is what it can't do, this is what we can realistically expect. What are your questions? And, that's a huge part of just kind of helping people through that. So those are kind of the two main ways that psychiatric genetics kind of comes into my work. And then secondarily, I mean, there's also going to be times when, people just have questions about how it runs in the family. Should I just, I've had a lot of people ask, should I just avoid having kids ever because I have this diagnosis or because my family does? And I think it's good to just be able to kind of break down some of those questions and get people talking about it.
Yeah, that's really fascinating. I was really curious to hear what you had to say about that, because I've never really seen a psychiatric specialty or that kind of position with genetic counseling, but that's really great.
Yeah, it's very unofficial. It's definitely not like in my job description, and I don't want to pretend that I'm an expert on it. For that, I would definitely talk with Jacquelynn Austin or Emily Morris or some of those other ones up at UBC. But and Jacquelynn Austin also has a really great book out, which I have on my shelf over here actually, but it's about psychiatric genetic counseling. So I would encourage you or anyone watching this to check that out if you're interested.
Okay, absolutely. Now I got off track a little bit there with the psychiatrics, but when for your graduate program, is there any factors that played into the program you ended up choosing? Like how you went about choosing that program?
Yeah. So it's a little different now than it was when I applied. So I was the last year of applications that did not have the match program. And so for us, it was you interview at all these different programs, and then each one tells you if they accept you or not, or if you're waitlisted. And then you had 3 days to make a decision. So it's a little different now. But I think the same, considerations still go into it. So for me, it was about location. So I didn't want to, be in a place for 2 years that I didn't want to live. It was about cost, of course. And primarily, though, it was about, I thought, the quality of the education. And so I wasn't really looking for like the oldest program or, the one that seemed to have the, I don't know, there's all kinds of different ways you can, evaluate different programs. And at the end of the day, they're all good. They're all going to make you, an accredited genetic counselor. But I ended up going to the University of Cincinnati, Cincinnati Children's Hospital program, because I lived in Cincinnati already, but I also really felt that they were kind of the best of all the possible worlds. So I had a choice of several different schools I could go to, and I was very, very torn about them because I really loved pretty much all of them. But what ended up making me choose Cincinnati was the huge diversity of different experiences that you could get there. So it's really all about looking at what they offer. So to me, I looked at the course list and I was like, these courses, first of all, there's a lot of them and they seem demanding and they cover a wide breadth of different things. Some of them, were programs that other schools didn't have. So for example, embryology. A lot of programs out there have their students actually watch the online Cincinnati embryology lectures, to kind of incorporate those into their program. And for me, having that ability to actually sit in class with the professor and ask questions and get feedback and stuff was super helpful. Teratology, so the study of, different exposures to things during pregnancy and how that can affect fetuses and infants. That's something that Cincinnati had that a lot of others don't, epidemiology. And part of that is because the program director really values public health and statistics and research. And that's also another reason why Cincinnati has a huge research component to it. So I believe every program has you do a thesis or a capstone project or something like that. But at Cincinnati, it's very, very, very rigorous. And I'm not going to lie and pretend that it was fun all the time. But I just looked at it and I thought, like, I want to really get as much as possible out of the 20 months that I'm in a program, and they pack so much in, and that's just what I wanted. And I don't think it's wrong to want something else, obviously, because they're all good and they're all gonna, absolutely, fill you with knowledge that you wouldn't have had otherwise. But for me, I really liked all of the different aspects to it. So it's the coursework, it's the research, it's all the different clinical experiences. But in addition to that, it's, just kind of being at a worldwide medical center. So all of the different experiences you can have there in terms of like case conferences and, experts speaking on different things, and you can kind of just like pop in and go to different talks. So there's just a lot to it. And that was really my primary concern. And I would have gone out of state and paid more for another program if I thought that they would have that same kind of experience. But it ended up just kind of being, like I said, kind of the best of both worlds. So I know my friends that went to other programs had equally good experiences at theirs. So I think it really just kind of depends on what you're looking for.
Okay, yeah, that's really great. I noticed with Cincinnati having the classes that other programs end up attending still. I guess that's a really good testament to their, how great their program is. I am doing a case study program that they have there as like a way to get some extra exposure with the pandemic and everything else. But yeah. And I was wondering, you said you work right across the river from Cincinnati now. So how much, I've heard that it's easier to get a job after graduate school if it's near where you went to graduate school. How true would you say that notion is?
I've actually never heard that before. I think what I have heard and what I've experienced to be true is that you're not going to have trouble finding a job. And I think that'll be true for a long time in genetic counseling, but you can kind of either choose your specialty or your location. And some people get lucky and get both, but I haven't heard that you have to kind of stay nearby, or that it's better if you stay nearby. I mean, obviously you're going to know more people, but I think everybody has different interests. And when you're looking at a class of like, Cincinnati has 12, other programs tend to be kind of smaller. You're not going to find a ton of people that all want to stay in the same spot and do the same thing. So that's not something that I've heard personally. Might be true for some people, but I think overall you kind of, have a choice of what you want to do, where you want to do it. And then if you can manage to make those things both happen at the same time, then you're lucky. So I got lucky in that regard.
Okay, well, that's definitely reassuring that you're not necessarily stuck in that place if you end up going there. So
no, my classmates went all over the place. I mean, California, Washington, I'm blanking on all the other ones, but yeah, you can go anywhere. It doesn't matter.
Okay, that's awesome. And so with your specialty being mainly prenatal, what made you end up choosing that specialty over the other ones?
Yeah, I'm a simple person and I just found it more interesting. I thought when I went into school that I, wanted to do cancer or something like that. One thing that I worried about when I went to Children's, and I actually asked them this during one of the like events that I went to before applying, but I thought, this is a children's hospital. Do I have to want to do pediatric genetics in order to, benefit from this program or, have a better chance of getting in? And they said no. And that's completely true. I mean, you can do absolutely any type of counseling that you want after going to any program. You might find that there are some programs that focus a little more on certain things than others. For example, my experience at Stanford was they're very into like, the forefront of genetics and research and, technology, things like that. Some programs are more psychosocially oriented. So, there's a few different, specialties or, strengths that each one will have, of course, but so no, you don't have to be interested in any certain thing when you're going into school. And then to actually answer your question, instead of the thing I rambled off on, I noticed as I was going through rotations that in prenatal, it to me, it just felt like it had the highest highs and the lowest lows. And I am someone who enjoys a challenge. And I think that prenatal counseling can definitely be challenging at times. I work in a center that has, I would say, 80% of people that I see are low risk. Nothing ever happens. It's very standard. And every once in a while, you get a very big surprise. So I think that's definitely less stress than working in a center where every single thing is an abnormality or an ultrasound finding or something like that, because there are prenatal counselors who work in those type of centers, and that's not me. But I just find that I enjoy that particular kind of challenge, and every field of genetic counseling has its own challenges. For me, the challenge of working with other types of patients is not a challenge that I enjoy, whereas prenatal counseling is a challenge that I enjoy. So I think that's probably just the simplest way I could put it. It's also just really interesting because, you don't have to pick a particular part of the body to focus on. We counsel about the heart and the brain and the limbs and the gastrointestinal system and growth and drug exposure and mental health. I mean, it's just absolutely everything. So to someone who has trouble picking one thing, which is definitely my personality, I think prenatal has a lot to offer there. So that was kind of my thought process.
Yeah, absolutely. It seems like, I mean, either way, it would work itself out when you do your rotations, I'm assuming, because you'd be able to be exposed to everything. And I definitely like the sound of that kind of built-in diversity in your cases, though. It seems like that would be something that's, enjoyable, especially with wanting to be challenged, but maybe not in a way that's a really difficult case every single time, or one that's maybe very intense or emotional.
Yeah. And I'm trying to be very mindful of not making it sound like other fields of genetic counseling are not also challenging. But I think, like I said, they're all challenging and rewarding in different ways. And I think, whatever your individual personality is gonna kind of tell you which one that you're drawn to. Or sometimes you're drawn to multiple ones or not one in particular at all. And either way, I think there's still a lot of jobs and opportunities out there for, any type of interest.
Yeah, of course. So on a kind of similar note with particular cases within the realm of patient privacy and everything, is there a case that stands out to you as one of the most memorable cases you had that maybe it taught you a lesson, or it was like a transformative case for your career?
Yeah. This was the hardest question of the set of questions that you asked me. And, everybody always asks this question, so you would think that I would have a good answer by this point. But there definitely are ones that stand out. I think what they all tend to have in common is cases where something is clearly going on and we can't figure out what it is. And I think that is also kind of an answer to a separate question, which is, what's the most challenging part of this job? I think going into it, I would have thought that the most challenging part would have been giving a diagnosis that was difficult. In reality, I think what it is, and the patients that I tend to remember the most are the ones where you can't give a diagnosis, and despite your best efforts and despite all the testing and despite all of your knowledge and everything else, you end up not being able to tell them what happened, especially when it's, a pregnancy that they lost or an infant that they lost, or even something that they're going through themselves, because I also do, a fair number of adult genetics cases. I think the lesson that those teach is that contracting is super important. So I'm sure you and your listeners have come across that term before, just this idea of setting expectations, getting to know someone, what are their values, what do they need, what can you realistically provide, and pre-test counseling. And, just kind of setting those expectations that yes, genetics is amazing and we are learning so much and we know so much more than we ever have before. The technology is amazing. All of this stuff is true, but at the same time, we are not going to find answers for a lot of people. And that's really, really tough. And it's something that I really had to learn as I was going through, because I've only been practicing for 2 years, but, definitely over the first year or so, I kind of had to learn, like, all right, you don't want to always be thinking this symptom goes with this and this symptom goes with this and this is the list of diagnoses and we're going to find the diagnosis. Of course you do want to be thinking that way, but the answer a lot of the time is no answer at all, and that sucks. But I think it's important for us to keep that in mind, and also just know that, like, there is more work to be done, and even if you don't find an answer the first time, keep working with patients, and as patients keep working with healthcare providers and with researchers, and if you want an answer at some point you can hopefully find it. But yeah, it's a learning curve to try to be realistic.
Yeah, it's really interesting that you say that, because I actually had a similar notion about, assuming maybe giving bad news is or a bad diagnosis is something that would be really difficult. And I actually had a conversation with a counselor where I guess I realized that a lot of times maybe you could be giving good news in the sense of, like, maybe something is like a negative result for a test, but then in asking that question, I realized that the good and bad can also be totally relative to the patient. And in addition to that, no diagnosis is also possibly a devastating thing, because they're still extremely confused and trying to figure out what's going on. So
right, exactly. Yeah, like you've still got a baby that has a lot of issues and you didn't get any answers, and I think that's really frustrating for a lot of people. Or even, if I'm giving like a negative cancer result, like you would think a negative genetic result on a cancer panel would be great news, and for a lot of people it is, but for someone who's had a ton of cancer already and none of it makes sense and we can't really connect them to anything, it's like, I actually asked them, is this good news for you? I mean, how do you feel about this result? Are you relieved? Are you disappointed? Are you both? And I think those are important questions to ask.
absolutely.
Mm-hmm.
Well, on the flip side, at least, what would you say might be the most rewarding part of your career?
Yeah, I definitely love getting to see people who, because especially in genetic counseling and in prenatal genetics, you don't always, get to see the same people over and over again unless they come back with a different pregnancy. But, I love just kind of getting to make difficult questions easier for people. And I've had, some people kind of share that, like, they feel like genetic counselors are a little bit more able to spend the time to work with people to, really look into their questions deeply and, follow up with them regularly. And, they don't get lost in the shuffle as much. And that's kind of the most rewarding thing, is when I hear something like that, like, this was a really, anxiety provoking time for us, or we were really confused, or we, weren't sure what was going on, and other people weren't really necessarily, being as responsive. Just knowing that, there was anything I could do to make someone's time like that a little bit less stressful, is definitely really rewarding. And it's a function of the way that we work, which is that I don't have 60 patients a day, and I have time to actually, work with each of them and be responsive and attentive to each of them. So, definitely there are things that I wish I did have more time for, but one of the other questions again that you had sent to me was kind of just this idea of like, what is your daily work life like? And where I work, I'm fortunate that I see 4 or 5 patients a day, sometimes fewer, sometimes more, depending on what's happening. But having half the day where I'm able to actually follow up with people and do notes and do research and just call and catch up with them is definitely really valuable. So I would say that's really rewarding, just being able to, make things go a little bit smoother for people.
Yeah, that's so great to hear. I'm sure that's kind of intuitively the most rewarding part, or what you would expect out of this career, which would be like those highs rather than the lows, and those good conversations you get to have with patients. But I'm sure until you actually are doing it, you can't fully appreciate that. I definitely have noticed, I've started this summer doing a volunteer text line for a crisis text line. And so that was something where, although it's, I guess, a prerequisite now for programs, once I started doing it and having feedback from the people I was helping, and just seeing their issues be resolved through our conversations, I could definitely appreciate why I was being asked to do this, or why it was suggested to do that. So hopefully that's a little bit of a taste of what it would be like eventually to help people on maybe a grander scale with a more serious condition.
Yeah, I think so, because, like I said, I did the suicide hotline as well, and crisis hotline, but in both situations, you're not solving anyone's problems, right? Like, I'm not fixing the genetic problem. I'm not, fixing anyone's depression or anything like that. But to just make that one day or that one moment a little bit easier, and you can kind of just sense that palpable relief from them, it's powerful. So I definitely would agree that that's a good thing to experience.
Absolutely. It's definitely very exciting. And so the last thing I have for you is whether it would be what your advice might be for a current student or a current individual who's looking to apply to a graduate program for genetic counseling, and whether that might be like a more of just an attitude, like an intangible attitude to have, or that kind of wisdom, or if it's something for actual applications and those materials.
Yeah. I think my biggest advice in terms of, like you said, kind of an intangible attitude to take, I know that it probably does feel like it literally is a requirement that you have to do X, Y, Z. I think that, crisis text line and any type of, activity in which you're working with individuals in crisis basically is a prerequisite. But it doesn't have to be a hotline. It doesn't have to be a text line. Like, find other ways of getting yourself out there and putting yourself into these situations, and really ask yourself how it feels. Because I think the number one most important thing is figuring out, like, you're going to be putting in a ton of time and effort and money into getting this degree, and even just applying for school. I mean, it's a lot of resources you have to put into it, and you don't want to do all of that and then come out and realize I don't actually like this. And yes, it is a very varied degree, and you can do a lot of different things with it. And I think that's one of the most exciting parts. But really, really, really ask yourself, like, do I like what I'm doing when I'm preparing to enter school? And if the answer is no, then maybe this, isn't the right path for you. I would also just say, like, I know everybody says this, and it is kind of easier said than done, but just be genuine. Seek out things that you like. And if you don't like them, don't keep doing them. Schools don't want to see the exact same person on every CV. They don't want to see the exact same person in every interview. It's okay if you didn't major in biology or genetics. It's okay if you did. But when people are trying to figure out, like, well, how do I stand out in my personal statement, or how do I stand out in an interview? What do I do that makes myself, separate from other applicants? You can't cause yourself to be individual or unique by finding additional things to put down on the paper. You have to think about, truly what drew you to this and what your experience is on the way to it said to you about the experience and about what it would mean to you. So I would just urge people to really be introspective and try and gain insight on why you are actually doing this, because that's the only thing that's really going to make you stand out in a way that's genuine. And, I think in terms of, other things that you can do to help the application process, do your research and ask questions. I was a student interviewer at the Cincinnati program my second year. So I don't know if other programs do this. Some of them probably do, but at Cincinnati, they have a second year kind of do one of the interviews for each person, just so that the students can get a chance to talk to a current student and get their perspective on things. But I noticed when I was doing that some people either seemed to ask questions that were easily answerable on the website, or they got to me and they were just like, I don't have any questions. And it's like, just try to have some questions, just do a little bit of research and write some stuff down. I think that's really going to help. Because even if, you've heard all of the basic information 1,000 times, like there's, always so many things you can get out of different people and just kind of chatting with them and making it a conversation. So I think those would probably be my 2 most important points of advice.
That's definitely really great advice. Especially, I've heard the thing about the questions a bunch of times. Not having any questions definitely is something I'll try to avoid, and do that research ahead of time. But
yeah, and I mean, like, you don't have to like make up a question just to have a question, but you can always just talk to the person open-ended and say, like, what's your experience been of this or that? And it's okay to ask the same question to multiple people because they might all have different answers. So that's pretty much my spiel on that.
Absolutely. Yeah, thank you so much. And I think that's all I have for you right now, but I really appreciate you taking the time this morning to speak with me.
Yeah, absolutely. Thanks for doing this, and good luck with your applications and everything. And if you have questions about Cincinnati or specific things, feel free to message me.
All right. Actually, Cincinnati has a little like webinar for applicants tomorrow, so I'll be seeing that. But yeah,
Awesome.
Thank you so much again.
Yeah, you're very welcome. Have a good one.
You too. Thanks.
Okay.
All right, guys, once again, that was Jacquelynn Berton. I hope you enjoyed this interview. We have another one coming out pretty soon with a genetic counseling student, as well as some more general genetic counseling and applicant videos. Tomorrow is the first day you can register for the match, so stay tuned for that match registration video and some more information as the application cycle continues. Hope you enjoyed this one and have a good one. See you next time.